Visualase is a step change in the treatment of brain tumours. It allows us to treat tumours that we couldn't treat before, and it allows us to access locations of tumours that we couldn't treat before. I'm Ranjiv Bangu. I'm a consultant neurosurgeon here at the Harley Street Clinic. Currently, Professor Ashkan and I are the only two neurosurgeons in the United Kingdom doing Visualase. Myself and my colleague treat each case together to make sure that we really offer that extra level of care and scrutiny to each case. We want to be able to offer patients the very best treatment, the very safest treatment, but also be pushing the boundaries of what we can do.
My name is Professor Keomars Ashkan. I'm a professor of neurosurgery here at Harley Street Clinic. Visualase uses the heat from a laser accurately placed into the tumor to heat up and destroy the abnormal tissue. In Harley Street Clinic, we're very lucky to have access to ROSA robot. Accurately using a robot, we can pass a very fine catheter all the way down into the tumor. Once we are in the tumor, we do real-time MRI imaging so we can check the position of the catheter in the MRI scan. And we can then use a laser to heat up the tumor. We can see on the MRI the temperature map, so we can be sure that we're hitting the tumor and not the surrounding brain. So using a very controlled, very measured, real-time MRI targeted, we can essentially burn the tumor and kill the tumor. So instead of having to make a big opening in the skull, shave the hair, make a big cut, or remove a big bone disc to access the brain and the tumor, with Visualase technology, we can approach a tumor through a tiny, tiny, small incision. It's an incision that we can close up with just a single stitch.
So one of the great advantages of Visualase is that it should significantly shorten the length of stay that patients are required to be in hospital and the time that patients should be in ITU. That's a great advantage.
Patients are coming in, having the treatment and go home next day.
We ourselves couldn't believe how well the patient looked after the operation. So it's remarkable. If you wanted to know more about Visualase, I would strongly suggest that you get in touch with us at the Harley Street Clinic and we can then discuss your case in detail.
What's so exciting about the Reflux Centre at the Lister Hospital is that we are bringing together the right experts for the first time in London, all of whom have got an interest in the treatment of reflux, so that we can offer literally life-changing treatments to these patients. 20% of the population at least will experience symptoms on a regular basis. When we swallow, food goes into our mouth and throat, and then it passes from the esophagus into the stomach. With reflux, the valve at the bottom of the stomach, which normally keeps acid and other gastric contents within it, fails. Those gastric contents then come back up into the esophagus, sometimes into the throat, sometimes into the lungs. When we think about reflux, we all think about heartburn, indigestion, but it can cause a whole host of other symptoms as well. In the UK alone, £500 million a year is spent on antacid medications. The biggest reason for that is that antacid tablets don't actually cure the problem. Many people do not want to undergo what they consider to be quite invasive surgery. The LINX device in many respects is a game-changing procedure. It comprises a small bracelet of magnetic beads which we place around the bottom of the esophagus in a keyhole operation. What happens is that when patients swallow, the beads distract, allowing the food to pass into the stomach, and then they close behind, and that then strengthens the normal valve and stops reflux. It's minimally invasive, it's normally done as a day case, patients go home on the same day as the operation, and usually they're back to normal within just a few days. If you've got problems, then I encourage you to come to the first reflux centre at the Lister Hospital in London, and we'll do our best to treat you.
Happy birthday, dear Lister. Happy birthday to you.
I'm incredibly proud of the fact that I'm now clinical director of the Lister Fertility Clinic. The Lister Clinic was opened by Mr. Abdullah back in 1988.
The whole clinic was tiny and we probably had 3 or 4 people working in the lab. We've just got bigger and bigger and bigger. We were one of literally a handful of fertility clinics in London. We introduced so many of the new techniques way ahead of everybody else.
I've always had a very strong call to be a mother.
We
never expected for me to get pregnant, we never expected for me to carry it to full term, and we never expected for me to have a healthy child.
We were the first clinic that really did egg donation in this country.
I donated eggs at the Lister twice. It turns out I am really fertile and I was able to help some people by donating my eggs. The Lister were really helpful and lovely at every stage. You start the stimulation injections, then you kind of get to the final bit where your eggs are ready, and then you get the egg collection operation. After the operation, I was able to find out that my recipients had had a girl and a boy, so one of each.
There's never been any advance in fertility treatment that's been significant that hasn't happened at the Lister. We're treating patients pre-cancer treatment, giving them the possibility of having children when they've recovered.
I was diagnosed with breast cancer. So that was a shock, because instead of being able to create a life and have a child, I was actually saving my own. We made a plan. I would undergo a round of an egg collection, and we just kept our fingers crossed that all would go well, because then after that I would have to undergo the cancer treatment. As soon as I jumped onto the cycle of radiation, there was no going back to try and have a child naturally.
Mommy, I'm going to put one in your hair.
Thank you.
So you can get pretty, okay?
Thank you.
9 months later, at the end of December, we had our big little miracle, or little big miracle. I don't know what, but yeah.
One of the main differentiators of IVF clinics is the quality of the lab. The equipment we have allows the embryos to develop in the best possible way.
We're looking into a new technology, new technique, a new treatment protocol all the time.
One of the other things that's changed over the last decade since I've been here is the success rate of egg freezing.
I was diagnosed with endometriosis. I was very quickly told that my fallopian tubes were completely blocked, and so there would be no chance really of conceiving naturally. I was told that I was a really good candidate for IVF because I was young. We started in August and my daughter was born in May. When we came to have our second child, it took us another 3 rounds. Baby Uma was born November 2015, so it was lovely. Then we had this looming frozen third embryo. We were not expecting the frozen embryo to work at all. And in the new year, our embryo thawed beautifully. I'm gonna cry now. And yeah, we were pregnant again. Sorry, I wasn't expecting this. Ooh.
We've created parents, we've created grandparents, we've created aunts and uncles.
I love the emails I get with pictures of babies. I particularly love the point where they bring those babies in a few months later for a cuddle, which I insist on.
The success of having had our daughter was down to everybody at the Lister.
You'd never imagine how much you change people's lives.
It's really amazing to know that some people out there now have families as a result of my donation.
They gave me 3 children. So without them, you know, I wouldn't have been a mother.
Happy birthday!
Happy birthday, Lister! Yay!
I've always had symptoms of headaches from probably a little girl, but we didn't really pick up on any of it. I gave birth and then 12 hours later had a seizure, and that's when we found I had a great big egg-sized tumour.
I first met Georgina shortly after delivery of her second child. A scan at that time had shown a large meningioma pressing on the left half of the brain. It was sitting up against a major draining vein, and damage to that risks stroke or even death. When it was obvious that it was growing, we undertook the Gamma Knife treatment.
My big worry was we had 2 children, but we did actually want more. So that was my first question to Ian was, will it affect my life? And he said, but Gamma Knife's so precise. It's a better way of doing it.
When it comes to dealing with benign tumours in the head, particularly when they're in a sensitive area close to major arteries or very delicate nerves, such as the optic nerves or the nerves of hearing and balance. Gamma knife is extremely effective. Gamma knife works by putting 192 beams of radiation through the head until they all get to the point where the lesion is, with an accuracy of better than 0.5 millimeter. Georgina's treatment was standard day case gamma knife. There was the frame fitting, the scan, the planning and the delivery of radiation, all finished by early afternoon.
There's no pain having the frame put on. Once you've got all your measurements right, then start the process. Lay there for probably an hour and a half. I stood 4 hours after I had it done watching my little toddler running in his little sports day, which is amazing. I was left with 2.2 cubic centimetre of cells and they're slowly shrinking to nothing. It's incredible, really.
The London Gamma Knife Centre offers the latest cutting-edge technology to treat patients. It's a fantastic facility, and with our 20 years experience of gamma knife radiosurgery comes a strong multidisciplinary team, all dedicated to choosing the correct treatment for each individual patient. Gamma knife will continue to be the treatment of choice for many of the tumours we used to operate on. If you'd like to know more about gamma knife treatments or the London Gamma Knife Centre, please get in touch with our expert team today.